In the name of Allah, who is most merciful and most beneficial. I, Dr. Ambreen, the course instructor of the subject Physical Agents and Electrotherapy 2. I'm today going to start a new chapter that is related to compression therapy. So in this chapter, we are going to study what is compression therapy and how we are going to apply what is physiological effects and what will be the possible clinical indications for this and what can be the contraindications, precautions, and meanwhile we'll also study the application techniques of the compression therapy. So what it is, basically the primary clinical application of this compression is to control the peripheral edema. And this peripheral edema may be due to some vascular or lymphatic dysfunction. And this physical agent that we are going to start is actually applied to help to prevent the formation of DVT as in the process of facilitating the wound healing. So moving towards this lecture, initially I would like to tell you about the learning objectives of this lecture. That includes the key features of the previous lecture. And this we are going to start a new chapter that is compression therapy. And today we will study about the effects and about the edema. What is actually the normal physiology of the fluid movement and how the edema actually develops. And in the next lecture and next session, we will study about the edema and the clinical indications of compression therapy. Moving towards today's lecture, firstly, go through the key points of the previous lecture. Last time we were studying about the ultrasound therapy and we were studying about the application techniques, the precautions, and the contraindications. Basically, there are three types of the applications of ultrasound therapy. You can either apply directly the ultrasound therapy, with either you can go through the immersion technique in which we can immerse the distal extremities like wrist, hand, and foot and ankle. And for basically that is for irregularly controlled areas. And we've also studied about the pad and bladder method. Coming towards the phonal process, it is the transdermal drug delivery by the help of sound waves. This is called phonal process. Means we are going to introduce the drug with the help of sound waves into tissues. And then next we have studied about the details of the contraindication, in which conditions we cannot apply ultrasound therapy and what will the possible precautions in case of ultrasound therapy. With this, we have actually completed this chapter and now we are moving towards the new chapter that is our compression therapy. Let me tell you what is compression. Basically, the application of a mechanical force that increases the external pressure on a part of body is said to be compression. Meaning a force, a mechanical force that is going to exert a mechanical external pressure on the part of a body or let's say a certain area, and it is going to increase the hydrostatic pressure of the tissues, mean interstitial spaces. And what is the significance of applying this compression and why we actually want to enhance the hydrostatic pressure of the interstitial spaces? This is the main thing of this chapter, that if you got like understanding of this point, you can easily understand the whole chapter. So moving towards this chapter, I have initially added few pictures that is going to tell you how we can give compression. We can either apply compression by using the compression bandages, like you can see in this picture. Most of you are very familiar with this. We can also use different compression garment, and they are present in the market with different elasticities and different extensibilities, and available on different sizes as well. So they are going to exert the pressure over the area, and they are going to help to improve the circulation of the area. So how they are going to do, and this we'll study about this in the next slides. And this is another type of the compression therapy, in which you are going to see that a compression device is going to be applied and over the limb. And these all techniques are for the areas that are actually present on the extremities. Compression is generally used to improve the fluid balance and the circulation and to modify the scar tissue formation. Basically, the compression is going to improve the fluid balance and circulation. This is the first and most important thing you have to understand. And next, what is this scar tissue formation? We'll study it in detail then. So what is the main topic of the discussion is how we are going to improve the fluid balance and circulation. Like you can see in this picture, there are two types of pressures. Like this, it is in hydrostatic pressure. The other one is osmotic pressure. So these two pressures are actually going to govern the rate of this blood flow or the fluid balance. So moving towards the next point, that compression, what it do is it improves the fluid balance. So how it improves the fluid balance? It actually increases the hydrostatic pressure in the interstitial spaces, and so it becomes greater than that of the vessel, so it in this way prevents the fluid loss. So let's take the example, what it is going to do. I am just take this example. This is your external pressure device, and you are going to apply over this area. So when you apply the external pressure, what it is going to do is it is going to increase the hydrostatic pressure. Basically, when we know whenever there will be higher hydrostatic pressure, the fluid tends to move from the higher to lower area. So when I have high hydrostatic pressure in my like external to the vessel, so the fluid will not come out, it will rather move towards the vessel. So in this way, we will increase the the fluid balance. And this way, we also prevent the further fluid loss and improve the circulation of fluid that is externally present. It will move towards again back. So in this way, what you're going to do is you're going to keep the fluid in the vessel or return it to the vessel. It allows it to circulate rather than accumulate in the peripheries. By increasing the hydrostatic pressure of your interstitial spaces, you are going to keep your hydrostatic pressure high. So actually in simple words कि अगर मैं अपने जो vessel के बाहर वाला जो area है उसका hydrostatic pressure बढ़ा रही हूँ, तो अब फ्लूइड अंदर से बाहर नहीं आएगा, बिकॉज बाहर तो पहले ही प्रेशर ज्यादा है. सो मजीद ये वाला फ्लूइड जो बाहर मौजूद है ये अंदर जा सकता है, बट इट विल नॉट कम आउट ऑफ द वेसल. So I'll explain it with for certain diagrams and with the certain pictures. So I have also edited some videos for this. So coming towards the compression, basically there are two types of compression. Like it can be either static or it can be either intermittent. Static is in the form of like you're going to constantly apply the pressure over the area. Fine. It can be by the help of bandages or with the help of the garments. And by this compression device, you can say the compression is applied all over the limb and it is constant throughout the face. The second one is intermittent compression. And the intermittent compression, we are going to apply a force that is varying over the time. Mean we are going to apply the force for 30 seconds and 30 seconds rest interval. 30 seconds you are going to apply, 30 seconds rest interval. There is another additional type of intermittent compression, like you can see in this picture. See, there are 4 compartments. You are going to apply the pressure in the first compartment, then in the second compartment, then in third compartment, then in the fourth compartment, and then 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. So I said there are 2 types of compression: static compression or intermittent compression. Static is the one that has a constant force that is going to apply. Intermittent is one that you are going to apply the force with the rest intervals. And further, there are 2 types of intermittent compression, that in which you are going to give rest interval, or the other one is sequential, as seen in the picture. There are different compartments that you are going to apply it in the sequence. First, this compartment is going to move. This one, second is this one, then third one, and fourth one. Every time one compartment is going to compress, the other one is going to, others are going to relax, and one is again going to compress, the other is going to relax. So this is the picture of intermittent compression. This is another picture to show you. This is first compression, this one is the second compartment, and this one is the third compartment. Actually, we know the fluid has to move from the distal to the proximal area, so it has to move towards this area. So coming towards the effect of external compression, that what are the possible effects that this external compression is going to bring. So let me tell you, there are 3 main effects, and out of which the first one is the most important and most significant one. That is to improve the venous and lymphatic circulation. And the second one is to limit the size and the shape of the tissue. This is somehow different for you, so I'll explain this one later on. And the third one is increased tissue temperature. That by using the external pressure, we can increase the tissue temperature, so we may get certain effects that we want to increase by getting tissue temperature. So right now I'm going to share a video with you, and this video is basically about how what is the normal physiology of the veins and lymphatic, what they are doing. So I think you can see on the screen. Let's start. Before this, I would like to show this one first.
Ever wondered where all that water is? You might think it's in your blood, because blood is liquid, contained inside your arteries and veins. But actually, your blood only contains a small fraction of the water in your body. Many of the structures in your body, like your internal organs, your skin, your eyes, are made up of cells. And most of the water in your body is either inside those cells or around them. Now, the body does a good job of keeping the amount of fluid inside the cells at a constant level, but the amount around your cells can actually change. And your veins and your lymphatic system work in concert to remove excess fluid from the tissues if it builds up. But if there's impairment to either of these systems, fluid can build up in this extracellular space. And in particular, if you have impairment to your lymphatic system, the excessive fluid that builds up leads to chronic swelling known as lymphedema.
So what they are going to tell that the normal circulation includes the veins and the working of the veins and lymphatics. So if there is a blockage in any one of these two, or either in the veins or in the lymphatic system, we are going to develop edema. So the edema due to lymphatic vessel would be a lymphatic
Now, to understand
edema.
how and why this buildup happens, we need to talk about your circulatory system, your heart, your arteries, veins, and lymphatics. When your heart beats, it contracts, and that creates a high pressure in the arteries, which are the vessels carrying oxygen-rich blood throughout the body. Now, since your arteries are made of cells, the high pressure can actually push the smaller components of your blood, like fluid, out through the spaces between the cells. Now, if this were the whole story, we would have a problem, because fluid would leak out of your arteries and it would accumulate. And too much accumulation leads to what we call edema or swelling.
So what we see, what in this video is actually when the fluid comes out of the vessel, if this fluid is in excess, it is going to accumulate in the interstitial spaces, means around like externally around the vessels and the spaces of the between the parenchymal cells. And this fluid, excess accumulation of the fluid is said to be edema.
But our bodies are amazing, and to prevent this fluid buildup from happening, the body has developed a transport system called the lymphatic system to help maintain fluid balance. And this lymphatic system consists of lymph capillaries, which are located just below your skin. And these lymph capillaries are almost everywhere in your body and pick up the extra fluid. The capillaries join together into larger lymphatic vessels, and those vessels merge into even bigger ones until ultimately they return the lymphatic fluid to the circulatory system in the large veins near your heart. Now, along the way back to the circulatory system, the fluid passes through lymph nodes, which detoxify that fluid, helping your body to eliminate the toxins, bacteria, and pathogens that might be contained in this fluid, which accumulate in the tissues. Now, you might be wondering, how does this lymphatic system work? What helps the lymphatic system propel fluid through the entire body, just like our circulatory system does with our arteries and veins? To answer this question, it's important to understand that the lymphatic system works by pressure as well, just at a much lower pressure than is generated by your heart. Throughout the day, your muscles contract from the daily activities you perform, creating pressure in the spaces that contain the fluid. The pressure from the muscle contraction facilitates movement into the lymph capillaries, which collect fluid as well as larger proteins and toxins. So basically, fluid is collected in the capillaries and then propelled in one direction through lymph vessels, which contain one-way valves, due to your own body movement and by the small contractions that occur in and around the lymph transport vessels. Now, as we mentioned earlier, you develop lymphedema when you have a...
So I'm going to stop the video here because I will explain the lymphedema myself, and I'm going towards our main topic of the discussion, that is basically the effects of the external compression. So we said the first main effect is improved venous and lymphatic return. The second one is we can use compression to limit and the size and the shape of the tissues. And we can also use external compression in order to increase the tissue temperature. So moving towards the first point that I'm going to explain is how compression is going to increase or improve the venous and lymphatic return. Basically, the controlled application of the external compression has a variety of the effects on the body part. It vary according to the nature of the device you are going to use, according to the pressure intensity you are going to apply to it. So coming towards the two types of the compression, we said either it is static or either that one is intermittent. Static and intermittent compression devices both are going to increase the circulation. since both are going to increase the hydrostatic pressure by nature. I said whenever you apply the external pressure over the area, over the body part, what you are going to do is you are going to increase the hydrostatic pressure in the interstitial spaces outside the blood and the lymphatic vessels. So what happens if you are going to increase this hydrostatic pressure? Basically, an increase in extravascular pressure can limit the flow of the fluid out of the vessel into the interstitial space. मीन अगर हमारी एक्स्ट्रा सेलुलर स्पेसेस के दरमियान इंटरस्टिशियल स्पेसेस का हाइड्रोस्टैटिक प्रेशर पहले से ज्यादा होगा तो हमारी वेसल से फ्लूइड निकल के हमारे सराउंडिंग स्पेसेस में नहीं आएगा क्योंकि बाहर का पहले ही हाइड्रोस्टैटिक प्रेशर ज्यादा है वी नो द फ्लूइड मूव्स फ्रॉम हायर टू लोअर प्रेशर नॉट फ्रॉम लो टू हायर प्रेशर so what happens if I am going to increase the hydrostatic pressure of the external spaces? What happens, this fluid will not come out of the vessel, so it stay in the vessel. Further, this has a higher hydrostatic pressure, the fluid tends to move from here to the vessel. So in this way you are going to prevent further edema and you are going to resolve the edema by like moving this fluid either towards the veins or either towards the lymphatic. The next is intermittent compression. As we said, there are two types of compression. So let me explain what is the main difference between static and intermittent compression, how they are significantly different from each other. Long short story short is the constant pressure, static pressure is basically constant. So coming towards intermittent pressure, it is going to give you rest interval. So what happens is the rest interval when you are going to exert a contraction, you are going to exert a pumping action on the vessel due to which the fluid is moving towards like forward direction. So when you like give the rest interval, you allow the vessel to refill again, and when you again apply the pressure, you are going to allow this fluid to move forward, and the rest intervals you are again going to apply the like give the rest, due to which there will be more filling of the vessel, and due to this there would be like more like improvement in the fluid movement. So what I said we can improve the circulation more effectively with the intermittent as compared to the static. Instead, you have applied the static compression, and once you have applied the intermittent compression, this compression is more effective because it is going to exert more better pumping action as compared to the one you just has with the hydrostatic pressure of the interstitial spaces. Fine, you are going to prevent, but as compared to this, the second one is more good because intermittent is going to give rest intervals and going to apply the pressure. So in this way, it is going to work more effectively as compared to the static compression. So moving towards the next like important thing, in short, the intermittent compression is going to give you milking type effect. Like when you are going to apply, you are going to exert a pumping action. When you are going to relax, you are going to allow to refill. So this is set to the milking action. So when the venous and lymphatic vessels are compressed, the fluid is pushed proximally, and when the compression is reduced, the vessels are going to like refill with a new vessel. So they are ready to be pushed proximally in the next compression phase. So this is the difference between static and compression. So intermittent compression. So coming towards further two types of intermittent compression. One is the one you are going to give the rest interval and going to relax and going to contract. The other one is sequential, in which you have four compartments. Every time one compartment is going to compress, the second one, third one, then fourth one. So this is even more better than the previous one, the second one. How? Because you have different chambers and you are going to apply in chambers. Like you are going to apply the compression to first chamber, then to second chamber, then to third chamber, and you are basically going to cause a wave of like vessel constriction, moving in the proximal direction to ensure that fluid is pushed along the vessel. Basically, you want to push this fluid all towards the heart rather than towards the distal extremities, and rather to accumulate in the distal extremities and cause like inflammation or swelling. Sorry, edema. So what is this? Our compression is going to improve the circulation. That is going to benefit the patient of edema. How? In this way, it's going to prevent the formation of the venous thrombosis in high-risk patients. The patients which are having more chances or more prone to have DVTs, like the patient who are bedridden or sedentary lifestyle, or those who are having the like different types of surgery, are there on bad or different types of fracture. So in such cases, when they have a low like a level of the activity due to which there is more like chance of peripheral like edema, and due to which there can the possibility of the formation of the venous thrombosis. So this compression is going to help that it increase the hydrostatic pressure of the surrounding cells, due to which they are not going to allow the blood fluid to come out of the vessel and get accumulated. Further, this compression is going to facilitate the healing of the ulcers caused by venous state. So we'll explain this, how it is going to explain, like help or facilitate the healing of the venous ulcer. So let me share a video. This is also related to the like, edema and how the lymphatic edema is going to develop. There are basically different types of edema, and among which this lymphedema or peripheral edemas are different types. So we'll discuss the different types of edema in our coming lecture. So we are generally today discussing about that edemas, that how we can benefit edema with the help of this. So I'm going to start
Poorly
another
functioning
video.
or damaged lymphatic system and fluids.
This is basically related to how the lymphatics and how this compression is going to help, as I said.
A healthy lymphatic system absorbs and transports lymph fluid from the subcutaneous tissue back to the bloodstream. Lymph is transported through lymph vessels to lymph nodes, where it is filtered and detoxified before being returned to the venous circulation. When the lymphatic system has not developed properly, or lymph nodes or vessels have been removed or damaged, the lymph fluid may not drain properly. This disruption of the lymphatic system may result in chronic swelling in the affected regions. The FlexiTouch system is an advanced pneumatic compression device that has been clinically proven to reduce chronic swelling and stimulate lymphatic function. With 15 different treatment options, this system offers a variety of choices for lower and upper extremity treatment. The patented curved chambers of the garment lie perpendicular to the lymphatic pathways and apply gentle dynamic pressure. Depending on your prescribed garment and program, up to 32 pneumatic chambers sequentially inflate and deflate to apply the correct pressure to the anchoring filaments that attach to the lymph capillaries and cause the capillaries to open and receive lymph fluid. The lymph fluid is then channeled into segments that are called lymphangiones. Smooth muscle contractions in each lymphangione facilitate the lymph fluid movement into the next segment. This enables directional movement of the excess fluid from the affected regions of the body to the healthy regions, returning the fluid to the venous circulation and delivering significant and measurable results over time. The FlexiTouch system offers patients a clinically proven approach to self-management at home. And
so this was about how compression is going to resolve the edema. Now I'm going to share my slides again. So we were at the point that we can improve the circulation that can benefit the patient of edema. So you have seen in the video that there is edema that might be due to a number of the reasons that I am going to tell you. If it is due to somehow issue in the lymphatics or in the venous circulation, so we may improve it. We may improve this peripheral edema by using these compression devices that are seen in this picture, that we have applied the compression device that is basically going to include the sequences. You have seen there were different sequences. There are so many like sequences that they are going to exert one by one by one. So they were like inducing a wave-like feeling of the movement of the fluid. Moving towards the next point, that is to limit the size and the shape of tissue. This is another advanced use of external compression in case of some surgical procedure in case of amputation. What it is, basically the static compression garments, and this is use of the static compression garments. What it is, static compression garments and bandages acts as a second skin. Like in this picture, the bandage is going to act as another accessory skin that is going to hold the skin and going to act as a like supporter of the skin, due to which it is going to exert an elastic compression of element over the tissues, and it actually all the times increase the hydrostatic pressure of the interstitial spaces, that it does not allow any fluid to come in the spaces where there is a low hydrostatic pressure, and if the fluid get accumulated, it will de-shape or de-size the limb, and especially in case of amputation or in case of some burn injuries. So they are usually wrapped in different static compression garments and bandages in order to like limitize the shape and size of the tissue. And this effect of the compression is exploited when compression bandages are is being used for the residual limb after amputation. It is being used over the burn damaged skins or applied to the abdomen as well. Let me tell you the third effect of the compression devices. It is to increase the tissue temperature. And most of the compression devices, especially except those that has a built-up cooling mechanism in them, they insulate the area where there is applied. Like in winters, when we wear the warm cloth, or like any like number of like layers of the cloth, what is they are going to do is they are going to insulate your body and going to give you an insulating effect. They are going to give you thermal effect basically. Similarly, this is the indirect effect of this compression. You was not actually intentionally using, but you are getting this effect that is insulation of the area. So we are using this effect insulation of the skin that it is going to raise the tissue temperature. So in case of modification of scars, and we are going to use it. What I do is by insulating the area, by increasing the tissue temperature, it indirectly causes what it causes it like enhanced activity of the enzyme collagen. That is not like direct effect. It is not actually designed to cause the enhanced activity of the collagen. By nature, it is going to insulate the tissue, and due to which there is an increased tissue temperature, and due to which there is possibly the increased activity of the collagenase tissue sensitive enzyme that is collagenase. And what it do is it breaks down the collagen and what produced by these cells. So it is going to break down the collagen deposit that is present in the scar. So in this way, it is going to help or modify the scar tissue formation. Now moving towards the clinical indications of external compression. There are different types of the edema in which we can use them, or in case of clinical ulcer. Today we are going to discuss about the peripheral edema or simplest edema type. That is what it is, how it is going to help, and what is the basic physiology behind it. So what are the clinical indications? I said we are going to use it in edema. Edema can be of different reasons. It may be due to venous insufficiency. It may be due to lymphatic blockage, or it may be in order to be used in DVTs. We can use venous stasis ulcers. We can use residual limb shaping after amputation, and to control the hypertrophic scarring. So these are the possible clinical indications that in which we can use this compression, external compression. Let me tell you today about the details of edema. So this is very important because in this we are going to like discuss or revise the physiology of the vessel, their pressure, the hydrostatic pressure, and the osmotic pressure. So coming this, what is edema? This is the very important thing that you have a clear understanding what is edema. Edema is the presence of the abnormal amount of the fluids and the extracellular tissue spaces of the body. Normally there is a fluid accumulation, but if it is in limits and it is going to drain, it is of no like you will say it is edema. But if there is abnormal accumulation of the fluid, that may be of different reason that I am going to tell you, and the extracellular spaces of the body parts, then we will say this is edema. So let me tell you what is the normal equilibrium in the tissue. Normally, then we will move how the edema basically develops. Normally, when you are going to discuss the normal equilibrium in the tissue, there are two types of pressure that are very concerned, most important, and significant to discuss here. Number one is hydrostatic pressure. The other one is osmotic pressure. Hydrostatic pressure inside and outside the vessel is going to govern this fluid movement. What it is, basically, we know in physics, whenever the fluid moves from higher hydrostatic pressure towards the lower hydrostatic pressure. One thing. The second one is osmotic pressure. That depends upon the solute. Here, the solute particles are our albumin proteins that are going to be like produced by the liver. So, osmotic pressure inside and outside of the vessel is also going to go on. So, if there would be a high osmotic pressure in an area, what the fluid has to do is fluid will move from low like hydrostatic osmotic pressure towards the high osmotic pressure, because where there is a fluid in more concentration, fluid tends to move towards that area and tries to make an equilibrium. So this is basic physiology of the hydrostatic pressure and osmotic pressure. They said hydrostatic pressure is determined by the blood pressure and the effects of the gravity. while the osmotic pressure is determined by the concentration of the proteins inside and outside the vessel. The proteins are going to go on this osmotic pressure, and the blood pressure and the effects of gravity are going to control the hydrostatic pressure. So let's take this picture. I'm going to explain what is edema. I'm going to just wait a second. I'm going to minimize it. Normally, we know that the blood moves from the left side of our heart, meaning left ventricle through aorta, it is going to pump all over the body. So just take this is your left side of the heart that is going to pump the blood to the body, and this black one is your tissue in our body. So what is going to happen is this blood is going towards this tissue, and it is going to supply it. And I have actually drawn this as this picture hypothetically, that this is your the capillary area, capillary. So what is going to happen? And after giving the oxygenation to this tissue, what it is going to happen is it is going to convert into venules, and this is going to take the blood from here towards the right side of the heart. We know the right atrium. From right, it moves toward the right ventricle. From here, it moves towards the lungs. From the lungs, it moves, after getting oxygenated, it moves towards the left side of the heart. And from left, again, it travels to the left ventricle and then again to the body. So this is a normal picture how the blood is basically moving. So let me tell you, there are two types of the pressure. One is hydrostatic pressure, the other one is osmotic pressure. So what is going to happen? This is your artery, and these are your arterioles, and ultimately this is your capillaries, and this one is your venules, and this one is your veins. Fine. Usually the hydrostatic pressure at the arteriolar end is 35 millimeters of mercury. Fine. And the hydrostatic pressure, this one is your hydrostatic pressure, over the venular end is 18 millimeters of mercury. Fine. This is your hydrostatic pressure. While the osmotic pressure is, that is your also oncotic pressure, at this end it is usually 25 millimeters of mercury. And this is again towards the venular side, it is 25 millimeters of. Oncotic pressure basically depends upon the proteins in the blood. Fine. So I said the hydrostatic pressure towards the capillary end is 35 millimeters of mercury, while the hydrostatic pressure towards the venular end is 18 millimeters of mercury. While the osmotic pressure, means your oncotic pressure, depends upon the albumin protein, is although 25 millimeters of mercury on both the ends. If you see the difference between them, let's see the difference. The difference between these 25 and 35 is 10 millimeters of mercury. So I'm again going to draw it. Just wait a second. Now let me tell you about the difference between the two. Here you can see the difference between 25 and 35 is 10 millimeters of mercury. And here the difference is 7 millimeters of mercury. And here the difference is 10. Here the difference is 7. So by this actually picture, I want to show you, let's suppose in the arterial end, if the 10 molecules move outside of the vessel, let's suppose. And at this end, 7 are going to return back. And 10 were going outside, because the pressure difference between this area is 10 millimeters of mercury. So I am just taking an example. Let's suppose 10 molecules or particles are going outside of the vessel, and 7 are returning back. No, still there are 3 particles that are going to accumulate in these interstitial spaces. These are your interstitial spaces, and these are your parenchymal cells. So what is going to happen? 3 molecules have been accumulated. So due to which, what's going to happen? The fluid that is going to return back towards the heart has less blood. But Allah subhanahu wa ta'ala has made the lymphatic vessels parallel to the capillaries and arteries, and the purpose of this lymphatic vessel is to keep to like take these free particles in them in the lymphatic fluids that actually becomes lymphatic fluid, and due to which this lymphatic fluid that moves through the lymphatic vessels throughout the body, and it ultimately goes towards the heart. And the total cardiac output, our the total venous return is going to be again going to come in equilibrium. So in short, I want to tell you that if the particles like fluid moves out of the vessel, usually Allah Ta'ala has made a system in us that most of them come at the venular end. But still, if few particles remain outside the vessel, that are going to move in the interstitial spaces. Side by side, there are lymphatics that are basically running. So what is going to happen on the fluid that is accumulating or moving here and there is getting returned back towards the lymphatics, and when it returns back towards the lymphatics and it again move towards the heart, it is being normalized. But in case if this fluid starts to accumulate in the area, वो उसमें जमा होता रहे लेट्स सपोज के नॉर्मली हमें से 10 पार्टिकल्स बाहर जाते हैं, 7 रिटर्न हो जाते हैं, जो 3 वहां पे होते हैं थोड़ी देर बाद वो भी लिम्फेटिक्स में चले जाते हैं. बट इन केस ड्यू टू सम इशू मेरी जो वेसल्स का हाइड्रोस्टैटिक प्रेशर बढ़ जाए, देयर आर नंबर ऑफ द केसेस जिसकी वजह से हाइड्रोस्टैटिक प्रेशर बढ़ जाता है. सो लेट्स टेक एग्जांपल कि मेरा अगर हाइड्रोस्टैटिक बढ़ जाए और उस हाइड्रोस्टैटिक बढ़ने की वजह से जो फ्लूइड है वो बाहर जाता जाए ज्यादा स्पीड के साथ, और आने की स्पीड इसकी कम हो, वेसल्स की स्पीड भी कम हो, और लिम्फेटिक्स इसको रिसीव करने के लेस को 20 मॉलिक्यूल्स वेसल से बाहर जा रहे हैं और 7 या 10 रिटर्न कर रहे हैं, फिर भी 10 इतने हैं कि 10 ज्यादा है, उसमें से 3 लिम्फेटिक्स में जा रहे हैं डिपेंडिंग ऑन द प्रेशर ऑफ द लिम्फेटिक. Still, every day 7 molecules are going to accumulate in the interstitial spaces, and they are going to accumulate, and going to result to give you an edema. So this is basic physiology of edema. So what we have to do is right now we have to manage that hydrostatic pressure. So one of the reason of developing edema is hydrostatic pressure that is going to increase in the vessel. Vessels के अंदर hydrostatic बढ़ जाना एक और है, एक वजह. दूसरी वजह कि वो जो वेसल्स वेन्स के थ्रू दोबारा हार्ट की तरफ जा रहा था, अगर वो वेन्स पे कोई इनकॉम्पिटेंस या वेन में कोई ब्लॉक है, जो वेन्स वीक हो जाए या वेन्स को कोई इशू हो जाए, तो उसकी वजह से ब्लड का बैक फ्लो जब होगा तब भी वेसल्स में हाइड्रोस्टैटिक प्रेशर बढ़ जाएगा. ठीक है. और हाइड्रोस्टैटिक प्रेशर बहुत सारी कंडीशंस में, जैसे कि हाइपरटेंशन में हम कहते हैं प्लाज्मा वॉल्यूम बढ़ जाता है तो बढ़ जाता है. ठीक है. सो देयर आर नंबर ऑफ द रीजंस दैट कॉजेस द इंक्रीज इन द हाइड्रोस्टैटिक प्रेशर. अलोंग विद दिस ऑनकोटिक प्रेशर, अगर हमारा जो ऑनकोटिक प्रेशर है जो हमारा एल्ब्यूमिन प्रोटीन पे डिपेंड कर रहा है, अगर उसमें कोई अल्टरेशन होगी वो भी इफेक्ट करेगा. And one more thing I want to add here that is basically related to lymphatic edema, that is कि जो हमारी lymph vessels होती है ना, उनके अंदर ऑनकोटिक प्रेशर नहीं, ऑस्मोटिक प्रेशर बहुत ज्यादा होता है. इसकी जो 3 मॉलिक्यूल्स थे वो जो हमारे इंटरस्टिशियल स्पेसेस में क्यूमुलेट होकर और वापस उसके अंदर चले जाते हैं ना, वो इसलिए चले जाते हैं क्योंकि उनका ऑनकोटिक प्रेशर बहुत ज्यादा है. तो वो जो 3 मॉलिक्यूल्स है वो अपने अंदर अपने साथ अपने आप को इक्विलिब्रियम में लाने के लिए अपनी तरफ खींच लेते हैं. ठीक है. तो अगर हमारी वेसल्स का स्पेशली बॉडी के अंदर हाइपोएल्बुमिनुरिया हो, एल्बुमिनिया हो जाए, तो क्या होएगा कि हमारे ब्लड के अंदर प्रोटीन लेवल कम होंगे और हमारे लिम्फेटिक्स में भी ऑब्वियसली प्रोटीन कम होंगे, जिसकी वजह से हमें लिम्फ एडिमा भी हो जाएगा. Another edema is that we are very familiar, that is edema. क्या हमें कोई भी चोट लगती है तो हमें edema हो जाता है, and we know whenever there is a injury and there is coming of the inflammatory mediators वहाँ पे आते हैं, वो inflammation cause करते हैं. जब वो inflammation cause करते हैं तो vessel की permeability बढ़ जाती है. The point right now is कि जब inflammatory mediators inflammation करते हैं तो vessel की permeability बढ़ जाती है. तो ये जो blood यहाँ से leak out होकर extra cellular spaces में आता है, उसकी कॉज क्या है? ये वेसल की परमेबिलिटी बढ़ जाना. तो इस केस में हमने वेसल की परमेबिलिटी को कम करना है, ना कि हम बाहर का हाइड्रोस्टैटिक प्रेशर में. अब बाहर का हाइड्रोस्टैटिक प्रेशर इज हेल्पफुल, लेकिन मेन इशू इज आपकी वेसल की परमेबिलिटी बढ़ गई है. सो हमने ऐसी मैनेजमेंट करनी है कि हमने यहाँ पे वेसो कंस्ट्रक्शन करनी है ताकि ये वेसल की परमेबिलिटी बढ़ने से जो फ्लूइड बाहर आ रहा है इस वजह से ये तो पहले मेन कॉज को खत्म करें. ठीक है. और साथ में हम उसको एडिमा मैनेजमेंट के कंप्रेशन के जो वहाँ पे एक्यूमुलेटेड है वो यहाँ पे लिम्फेटिक्स की तरफ जाए या वेन्स की तरफ जाए और वहाँ से वो क्लियरेंस हो. ठीक है. सो ऑलवेज लुक फॉर द कॉज ऑफ द एडिमा के एडिमा किस वजह से है. सो मूविंग टुवर्ड्स आवर लेक्चर दैट इज एडिमा, in which we were studying about hydrostatic pressure and osmotic pressure. Hydrostatic pressure is again going to tell you determined by the blood pressure and the effect of the The gravity is also going to assist you. So in case of like the edema, we usually recommend the patient to always elevate the area or elevate the limb. For example, if there is edema on the hand, the patient is requested to raise the hand by keeping the pillows and like in this way. If there is edema in the leg or in the foot or in the ankle, the patient are asked to keep their leg like higher or keep the pillows under it, or when even he or she was, if she's sleeping, keep the pillows like under her leg to keep the level of the leg raised above the level of the heart. So next is, as we said, hide the hardest pressure. Inside the vessel acts to push the fluid out of the vessel. We know जब भी vessel के अंदर hydrostatic pressure ज़्यादा होता है तो जो fluid होता है वो vessel से बाहर आ जाता है. और अगर higher the protein content होएगा और higher osmotic pressure होएगा, inside the vessel के अंदर बिस्तर होएगा, it acts to keep the fluid inside the vessel. तो वो vessel को बिस्तर रखेगा और fluid को अंदर की तरफ move करके रखेगा. This is another picture to show you how the blood leaks out of the vessel. You can see, and this osmotic, due to the presence of this like albumin proteins, the fluid moves inside the vessel. Further, if the fluid get out of the vessel, it will turn back, but if it gets accumulated in this interstitial spaces, it has tendency to move towards the lymphatic, depending upon the osmotic pressure of the lymphatic vessels. So if the osmotic pressure is high as compared to the interstitial spaces, the fluid will move from here to there. So what we said, under the normal conditions, the hydrostatic pressure pushing the fluid out of the vessel is slightly high. Then the osmotic pressure keeping the fluid in results in slight loss of the interstitial spaces. Fluid in the interstitial spaces. The fluid that is pushed out of the vessel into the interstitial spaces is then taken up by the lymphatic vessels and to be returned to the venous circulation at the subclavian level. The fluid that is going to move in the lymphatic vessels is said to be the lymph. We have seen in the videos and in the pictures. So let me tell you this one more thing, that is lymph contains a protein, waters and macrophages. What it is, basically the fluid that is present in the lymphatics actually contains 15 certain proteins such as albumin, water and macrophages. This is a special characteristic of lymphatic. And a healthy diet, a vascular system, and level of the muscular contraction, all are going to help to resolve the edema to ensure that the appropriate amount of the fluid is existing in the veins and flow back towards the heart. But if there is a dysfunction in any of these mechanisms, it is going to increase the extravasation of the fluid from the vessel into the interstitial spaces, and it reduces the flow of the venous blood or lymphatic back towards the heart, and thus it results in the formation of edema. The most commonest reasons for developing the edema in the patient is venous insufficiency. This is what we have to discuss in detail. And the dysfunction of the lymphatic. If there is a dysfunction in the lymphatic system, mean कि हमारी lymphatic में कोई ट्यूमर है, कोई ब्लॉकेज हो गया, ये और lymphatic बंद है, ये congenital issues है, इस वजह से या हमारी जो veins है, इसका काम है कि deoxygenated को blood को स्पेशली जो periphery से है उसको हमारे heart की तरफ पुल करना. ठीक हो गया, उसके अंदर हमारे पास वॉल्स होते हैं, अगर वो वाल्व्स खराब हो जाए, और वाल्व्स का काम होता है जब भी वो नीचे से ब्लड पुश होता है तो ऊपर की तरफ आता है, ये वाल्व क्लोज होता है, फिर ये पुश करता है ऊपर की तरफ जाता है, यहाँ से वाल्व क्लोज होकर ताकि बैकवर्ड फ्लो ना हो. लेकिन अगर ये वाल्व खराब हो जाए, ये इनकॉम्पिटेंट हो जाए, जिसकी वजह हर बार जब ब्लड ने ऊपर की तरफ मूव करना है, इंस्टेड ऑफ ओनली मूविंग टुवर्ड्स द अपर डायरेक्शन, इट अगेंस्ट बैक flow, and due to this back flow, the fluid tends to accumulate in the peripheries and it tends to जो पेरिफेरल वेसल्स में एक्यूमुलेट हो जाता है, उसका हाइड्रोस्टैटिक बढ़ जाता है, प्रेशर बढ़ जाता है, तो जिसकी वजह से वो वेसल्स के बाहर जाना शुरू कर जाता है वहां से जो कि इंटरस्टिशियल स्पेसेस के अंदर. फाइन. So edema may be due to after like exercise, it may be due to like some trauma or some injuries, or it may be in case of burns, or even in case of infection where there is increased vascular permeability. That's it. Thus, that occurs with acute inflammation associated with these events. There are certain issues that may be like causes of the edema. So whenever there is increased vascular permeability, we know there will be increased fluid flow out of the vessel and cause accumulation of fluid at the site of trauma or infection. We know this point very well. And it's a certain condition that will contribute towards the peripheral edema, like any abnormal states in the circulation or osmotic pressure balance are going to affect this edema. So there are other conditions. The edema may be due to secondary issue like due to congestive heart failure, due to liver failure. It may be due to the acute renal diseases. It may be due to diabetic glomerulonephritis, due to malnutrition, and due to radiation injury. It is going to cause. So this was all about the edema. At the end, I also want to share a video that is related to the fluid balance. Let me share another video with you that is going to tell you the mechanism of edema. To have a better understanding, we have to go through this video.
Bismillah ar-Rahman ar-Rahim. This diagram illustrates mechanisms of edema development. Understanding these mechanisms is helpful to comprehend clinical causes of this symptom. Edema is defined as fluid accumulation in the interstitial space. Blood arrives to the tissue through blood vessels. We have the arterial system get continuous branching until we reach the very small arterioles. Then that give rise to the capillaries. And capillaries are the blood vessels that are in contact with the tissue. And the vessels through which oxygen and nutrient pass to the cells. Also, carbon dioxide and waste products enter the blood, which then drain into the venous system. Some fluid normally pass to the tissue and cannot get back directly to the blood. This extra fluid is not accumulated in the interstitial space, but pass to the lymphatic system, which ultimately drain.
So what they are saying, the fluid that gets accumulated in our interstitial spaces, they normally in all of us, if we are normal, तो ये फ्लूइड जो हमारी लाइक एक्स्ट्रा सेलुलर स्पेसेस या इंटरस्टिशियल स्पेसेस में एक्यूमुलेट होता है, अल्लाह ताला ने हमारे लिम्फेटिक्स बनाए हुए जिनका काम है वो उन लाइक फ्लूइड्स को अपनी तरफ लाइक अट्रैक्ट कर लेना, उसको वहां से ड्रेन कर देना. पर इन केस अगर वो नहीं लाइक कोई इशू है जिसकी वजह से वो नहीं जा पा रही, हमारा फ्लूइड ज्यादा एक्यूमुलेट हो रहा है लिम्फेटिक की वर्किंग की वजह से, देन इट वुड बी लाइक कॉज ऑफ edema. So let's see this video.
That fluid back to the blood. So, what are the factors that determine how much fluid passes to the tissue? Well, there are two kinds of pressure that play a role. They are the hydrostatic pressure and oncotic pressure. And also, there is the permeability of the capillaries. Normally, the endothelial cells of the capillary are in contact to each other, preventing much fluid to pass from the blood to the tissue. However, in case of inflammation, chemical mediators are released, promoting contraction of these endothelial cells, and this contraction causes these endothelial cells to shrink. This shrinkage allows the spaces between these endothelial cells to contract and to conduct extra amount of fluid to the tissue. That's why inflammation is associated with development of edema. Clinical example of inflammatory condition that might present with edema is cellulitis. Cellulitis is inflammation occurring in the skin, particularly it affects the epidermis and subcutaneous tissue. Then we have two kinds of pressure that interact to maintain the intravascular space. These pressure are the hydrostatic pressure and
So this pressure are hydrostatic pressure and osmotic pressure.
oncotic pressure.
So osmotic pressure is also called oncotic pressure. It depends upon the fluid or the particles that is actually the fluid, or right now here is our albumin proteins.
Hydrostatic pressure is determined by the amount of water in the blood vessel. So in case fluid is increased in the blood vessels due to any reason, the hydrostatic pressure increases. And if the hydrostatic pressure increases, then the extra water will pass to the tissue where there is less hydrostatic pressure. And this passing continues until we reach equilibrium. Examples of conditions in which vascular hydrostatic pressure increases include renal failure, heart failure, and venous obstruction. A major function of the kidney is to excrete extra amount of fluid. It is function in fluid homeostasis. So, in case of renal failure, we lose this ability. Fluid accumulates in the vascular space, increasing the hydrostatic pressure, and edema develops. Also, if we have venous obstruction, fluid will be prevented to pass through. Backflow of blood then to the capillary increases hydrostatic pressure and results in edema. Diseases that may cause venous obstruction include deep vein thrombosis and pelvic tumor. Also, abdominal tumor may obstruct the inferior vena cava, resulting in bilateral lower limb edema. The second type of pressure that keeps fluid inside the vascular space is the colloid osmotic pressure, colloid oncotic pressure. This type of pressure is similar to the salt that keeps fluid in its space. You know, if we have high salt in one side of a membrane, fluid will be attracted to pass into that side of the membrane. Oncotic pressure does the same, but it does not depend on salt but on proteins. The major intravascular protein is albumin, and it is synthesized in the liver. So, if we have low albumin due to liver disease, for example, oncotic pressure becomes low and fluid will pass to the interstitium. Causes of hypoalbuminemia include, beside liver disease that we discussed, nephrotic syndrome, in which protein is lost in the urine, and also cause of hypoalbuminemia is malnutrition. Finally, the last cause of edema, illustrated in the diagram, is lymphatic obstruction. This might be due to parasitic infection such as filariasis.
So this was all about the edema that we was discussing. This was all about edema. And with this, I'm going to wind up the session. Inshallah, we'll continue how the edema is going to be due to different causes. What is lymphedema? What is venous insufficiency and venous ulcers? And how we are going to manage them. So this will be in my coming lecture. So till then, kindly go through this video, and inshallah, see you in the next session. And we will discuss this in our interactive session as well. This I am going to say you Allah Hafiz.